Thank you very much for this very kind introduction and distinguished guests. It's my real pleasure to be here at your university to deliver this lecture. And I thought the first thing I would do is explain a little bit what ombudsman means, because you may have heard some people have ombudspersons, some people have ombudsmen, ombudsman, and I wanted to, at the outset, tell you that it is a gender-neutral word. It is Swedish, so the man in ombudsman does not mean man, it just means a person. The Office of the Ontario Ombudsman is a classical ombudsman model. Those are very few and rare. A classical ombudsman model is one that is fashioned around the Swedish ombudsman model from 1809. And the first ombudsman to carry that title, his name was Lars Marin, just in case you were wondering. So an ombudsman is an official appointed to investigate individual complaints against a company or organization, especially the public authority, according to Oxford Dictionary. Now, although the ombudsman was created in 1809 of Swedish origin, it started to catch on around the world, around Europe, and it went viral in Canada in the late 60s, early 70s, and the Ontario Ombudsman's Office was created in 1975. So this gives you an idea of the date on which, the year on which the provinces in Canada adopted the Swedish parliamentary ombudsman model. In Ontario, it means that I oversee over 500 different Ontario ministries, crown corporations, tribunals, agencies, boards, and commissions. Now, what exactly do I do as an ombudsman? The mandate is pretty wide. Over those 500 different bodies, I can investigate matters that appear to be contrary to law, was unreasonable, oppressive, unjust, or improperly discriminatory, partly or wholly based on a mistake of fact or law, or just plain wrong. And when I investigate a case, I make recommendations to the government to fix the problem. Now, I am an officer of the Legislative Assembly, which means that I'm not a government employee. I work for the elected representatives. I'm elected by them, and I'm accountable to them. And I occupy the position of ombudsman for 5 years. It's a renewable position. And I was appointed in April 2005. Some would suggest it was the biggest April Fool's joke of the government. I was then reappointed June 1st, 2010, after a very tumultuous reappointment process. You know, you may well have a sense that my job may not be a very popular one with government, because I investigate government, and you're absolutely right, it's not a popular job. And I made sure that when I was reappointed in 2010, I brought all my friends with me in the gallery of Parliament. The one important thing about the renewal, though, is that I'm the first ombudsman ever to be renewed in the job. So that is encouraging. So I am the 6th ombudsman to occupy the position in 2005, and I was renewed in 2010, so feel free to call me 007. Now, the role of the ombudsman has evolved over the years as a simple complaint taker to the position of policy shaper for several reasons. We have finite budgets, just like everybody else, and we find that we have a lot more effect punching above our weight when we tackle public policy issues and are able to resolve systemic issues that benefit hundreds, thousands, if not millions of people. And I'm here to talk to you about some of the work that we've done over the last few years. We've also, over the last little while, adopted a role as a promoter of open, transparent, and accountable government. So we're here to promote good governance. Since I became ombudsman in 2005, within the model of the Ombudsman Act of Ontario, we adopted many new strategies in order to strengthen our role as slayer of maladministration in Ontario. And part of the response has been to create the Special Ombudsman Response Team. This is a team within our office that is charged with tackling those tough systemic issues that cannot be resolved through informal diplomatic approach. And this model, the SORT model, has been adopted by the international community for very much the same role. We like to see the SORT model as an administrative SWAT team. It's a team that comes in, conducts investigations, and in a very methodical fashion moves out, publishes a report, and gets action very quickly. As I speak to you today, we have under our belt about 30 different SORT investigations. These are examples of investigations that can be found on our website. All the reports are published. And I can say with a fair degree of conviction that virtually everyone in this room has been affected in a positive way by our work in the Office of the Ombudsman. If you bought a lottery ticket in the last few years, you've been affected by our work. If you have been a victim of violent crime, you've been affected by our work. If you relied on legal aid, or if any of your friends or relatives have relied on legal aid, you've been affected by our work. If you've been affected by the distribution of money to your hospitals and the funding of hospitals, you've been affected by our work. If you had a newborn in your family, your neighbors, your friends, you've been affected by our work. If you own property, you pay property taxes, you've been affected by our work. And I could go on. If you've relied on, loved ones or friends or relatives who've relied on the treatment of cancer and the access to specific drugs for their survival, you've been affected by our work. So I'd like to give you a few examples of some of the things that I've talked about so far. The Municipal Property Assessment Corporation in Ontario is the corporation that values municipal properties, and you're taxed in the municipality based on the value of your property. We received in the year of 2006, 2005, many complaints that there were high error rates on how properties were valued in Ontario, leading to an unfair onus on some owners vis-a-vis others. And we also received complaints that MPAC was operating in a secretive, cutthroat attitude. And we responded by investigating MPAC. When we submitted our recommendation, the government imposed a freeze of 2 years on property assessments in Ontario in order to implement our recommendations and to make the property valuation system fairer in Ontario. Now, there are limits to the kind of work that we do. And a very important one is that although we attack issues of maladministration and issues of public policy in that we see ourselves as the oil in the machinery, we are not there to reinvent the machinery. That's the role of parliamentarians. And just as the judiciary respects the role of parliamentarians, we have very much that same obligation to respect the role of parliamentarians. So when we looked at MPAC, there were many people that were telling us that the system of valuating property is the wrong system, that there should be another system, that your taxes should not be based on property valuation. That is not my role as an ombudsman to decide. That's why we elect people. But once they've chosen that system, my job is to make sure it operates fairly, transparently, and effectively. Let's talk about Avastin. Anyone ever heard of Avastin? Avastin is a very important frontline drug to treat colorectal cancer in Ontario. Colorectal cancer results in Ontario in the most significant cancer death rate of any kind of cancer cancers apart from lung cancer, which has a cause, generally smoking. But no one really knows what causes colorectal cancer. Some say it's because in Ontario we don't have enough sunlight. It has to do with the fact we're not getting enough vitamin D. So, all to say that it's a very important issue is to properly fund the treatment of colorectal cancer. Accordingly, the government decided to fund Avastin in order to reach out to those that were suffering from colorectal cancer. However, in approving the medication, the government capped it at 16 cycles. That means that if you were on Avastin and you were being treated on Avastin and it was being successful in treating your tumors and reversing the progression of the disease, at the 16th cycle, you would be cut off arbitrarily. And we found out that in other provinces, there was no hard cap, and there was no medical evidence to support cutting people off. So you can imagine, you're dying of cancer, this drug comes along, you're getting better, and then you're cut off. In some cases, what would happen is that the disease would come back even stronger. So we recommended that the cap be lifted, and that the funding of Avastin take place as long as there is progress in disease treatment. Another example, newborn screening. This is a case we call the right to be patient. In Ontario, in 1978, we were the leaders in screening of newborn babies to prevent genetic and metabolic disorders. We were the leaders in the world. And I don't know if any of you have children here, but when a child is born in Ontario, there's a little prick of blood taken from the child's foot. And Ontario was testing for 2 diseases in 1978. We were the leaders in the world. Fast forward to 2005, the World Health Organization was recommending 29 disease tests at birth. Ontario, 2. We were stuck in 1978. We determined that the deficiency in testing of newborn babies was leading to a total of 50 babies a year killed or disabled by preventable disorders. In other words, if you alter the diet, you can prevent the onset of severe disease in children or death. The technology for newborn screening is being developed in Ontario, being shipped to Mexico. So your baby was better off being born in Mexico than in downtown Toronto. So we recommended that the Ontario government increase its commitment to newborn screening to the World Health Organization level in order to prevent the deaths of 50 or disability of 50 babies a year. The government agreed to our recommendations and announced that we've gone from worst to first. And we're very happy to see that today, as I speak to in 2011, that we are now up to the World Health Organization recommendations. And in fact, I must say that I was, I should say the word surprised, perhaps, to see during the election that the Liberal government was running commercials on newborn screening. So how great it is to live in Ontario. And they are right, that it is great to live in Ontario, except it's because of our report. So I see that as an endorsement of our work. What can I say? Let me talk to you briefly again about another case we did, the Criminal Injuries Compensation Board. You know that in Ontario, if you're a victim of violent crime, you're entitled to compensation. There's an act in 1976 that will give you all of up to $25,000 in the worst of cases. Well, we found out that in Ontario there was very serious problems in how that board was being administered, and that some of these victims had to wait over 3 years for the claims to be processed. In one case, we found people being sent 56 forms to fill out. Can you imagine? And in one particular case, the applicant, whose name had an I in it, had his form returned to him, and the I was circled because, in red, because he hadn't dotted the I in his name. Incomplete form. I kid you not. This is an organization that suffered from official document fetish. They got off on documents and papers. So we went in and we recommended that measures be taken to get rid of the backlog and to humanize the process. We had a case we looked at that one of the complainants was being denied funds to bury his 6-year-old daughter who had been murdered. And of course, if you buy lottery tickets, you'll be aware of our investigation into lottery fraud, where we investigated how retailers were lining their pocket with property winnings, that the Ontario Lottery Gaming Corporation was unaware of the number of retailers it had. It did not conduct security checks in the background, were not registered. Basically, it was the free-for-all, and the CEO of the Lottery Corporation was made aware that there was likely rampant fraud in our lottery system. And he said in an email back to the person in the organization who had warned him, sometimes you have to hold your nose. In other words, he knew something fishy was happening, you just keep writing checks. So we conducted an investigation on the OLG, and we recommended several things, new security measures, that you have to sign the front of your lottery ticket. You'll realize that that is new. As a result of our work, there was an audit done of inside wins, and they found that $198 million had been won by insiders in suspicious circumstances in the last 13 years. You can imagine that amount of money. This could be your lottery ticket. The OPP then came in, and from the report that we published followed the trail, and has since laid many criminal charges against retailers who had stolen the winning lot in lotteries in Ontario. The OLG was thankful for our work and told us that they believed that without our report, this kind of fundamental change would not have been possible. Then, of course, the G20. We all saw scenes of the G20 of serious abuses of civil liberties. Thousands of people arrested, illegally detained. We investigated that case, but as the Ombudsman of Ontario, I have no ability to investigate the police, but I do have the ability to investigate the provincial government. And what we discovered when we launched our investigation is that the provincial government had relied on 1939 piece of legislation called the Public Works Protection Act. 1939. And the Public Works Protection Act authorizes any peace officer or guard to detain or arrest anyone for any reason. All right? Now, something happened since 1939. It's called the Charter of Rights and Freedoms. That happened in 1982. And that constitutionalized citizens' right to be free from illegal, arbitrary arrest and detention. And what we discovered is that the provincial government had passed a new regulation under that act, reviving the 1939 piece of legislation. And that piece of regulation had not been publicized. Now, why would you think the government would not publicize such a highly contentious amendment to police powers during the G20? Possibly it would suggest that there was concern that civil liberties organizations would mount challenges that would then render unconstitutional this piece of regulation. So we published a report finding that the regulation was likely contrary to law and the Constitution. We recommended that the government firstly get rid or revise this piece of legislation to make it constitutional. And number two, if you're going to change the rules of the game, prior to a protest, you have to publicize it so that citizens who want to peacefully protest are aware of the limits to their right to protest so that they can challenge them or abide by them. The government hired the respected retired Chief Justice of Ontario, Roy McMurtry, to review our findings, and he agreed that the legislation had a potential for abuse and that it should be scrapped. And the G20 legislation was agreed upon by the government to be scrapped, but I warn you, as we speak today, it is still in effect. It's still in effect because we had an election in between and the government did not have a chance to repeal the legislation. It's promised to do so, and I fully expect it to be repealed. But until then, beware that it's still in effect in Ontario. Our model of doing our work has been observed by the international community, and what you see now is an international map where we have been to teach our methods of investigation of systemic issues around the world. The International Ombudsman Institute has this over twice a year in Vienna, where European nations come to learn from us. We've been on all continents of the world. We offer the course free of charge, but on a cost recovery. So these countries bring us in. We've been to Namibia, South Africa, Morocco, Ethiopia, all around the United States. We've taught it to Chicago police and internal affairs, of all places. And of course, we've taught it pretty aggressively around the world. And at the end of November, we offer it every year in Toronto, and it's attended by countries from around the world. Now you might ask, you've talked about provincial ombudsman, but we didn't hear you talk about federal ombudsman. And you haven't really heard me talk about the federal ombudsman because there is no federal ombudsman. There was an act presented to Parliament that had its first reading in 1978. And there are two reasons really why the act didn't go through. Is that on the one hand, there was a reaction by some federal ministers in Pierre Trudeau's cabinet that why add another layer of oversight when we have the courts, the media, and parliamentarians. And the other reason was this guy, the first Ontario Ombudsman. Now, some people find me aggressive in my job. Well, he takes the cake. He makes me look like a pussycat. And the Arthur Maloney was a very noted criminal defense lawyer who became the first Ombudsman of Ontario and ran his office very vigorously and aggressively. And there's a story, grapevine, that he was so aggressive in Ontario that he scared off people in Ottawa. And then they pulled the plug on the bill. But there's also the other argument that I tell you that it's starting to hear all the time, the courts, the media, the parliamentarians. But we know that there are limitations to these different avenues. Now, the courts are there to deal with narrow legal issues on an adversarial basis. Now, how many judges have told me over the years that they very much appreciate the work of our office because we look at broad issues. We don't look at issues right before the office between the parties. We look at them impartially, and it's not adversarial. And can you imagine what it takes to fight issues before the courts? Years, thousands of dollars. We're free. Parliament, we heard some debate about this in the last election. Well, we don't need to extend the Ombudsman's oversight to hospitals because that's the role of parliamentarians. Well, it's not, because elected MPPs cannot exercise any direct jurisdiction over hospitals. Elected MPPs are part of politics, partisan politics. They don't have the resources, they don't have an act to back them up. So they can't do the kind of work really that I do. I'm here to support their work, and we work in a complementary fashion, not in a way that excludes each other. And the media, we all know, are not properly positioned to pursue the public interest in a way that an institutionalized office can. So what we have on the federal level, though, are a multitude of what you call organizational ombudsmen. You've got the National Defense Ombudsman, the position I used to occupy. You have the Veterans Ombudsman, the Passport Ombudsman, the Heritage Ombudsman. You have them everywhere, but these are organizational ombudsmen. They're devoid of a statute. They're void of the institutional independence that an officer of Parliament has. I cannot be fired unless I commit an act of bad behavior, if I commit a crime, for example. And even then, there has to be a vote of Parliament to remove me from my office. None of these federal offices enjoy that level of independence and impartiality, the ability to public report and to lay out the kind of investigative model that we have in Ontario. Now, some of the countries like New Zealand and Denmark, in New Zealand, the Chief Ombudsman of New Zealand has to approve everybody that calls itself an ombudsman. Otherwise, by law, you're operating illegally. Now, that's an idea, isn't it? I mean, anyone right now in Canada can put up a shingle and call himself an ombudsman. And you have them. You have a hospital ombudsman that have dual role as patient advocate, ombudsman. Universities have ombudsman. Banks have ombudsman. Kodak has an ombudsman. Coca-Cola has an ombudsman. Did you know that? I mean, they're everywhere. And they don't require particular training, particular infrastructure. But in New Zealand, you have to be approved by the Chief Ombudsman, otherwise you're operating illegally. Just like universities, I can't just set up a university in my backyard and say, I'll be the university of whatever. There's some rules, there's procedure, there's regulation out there. And unfortunately for the Ombudsman in Canada, we're an open profession. And that's why our office has taken the role to go out there and try to raise the bar and become ombudsman evangelists, if you like. In Denmark, the approval of Parliament is required before someone calls himself an ombudsman. So there's been this great proliferation of organizational ombudsmen everywhere, in Canada, the US. And in the private sector, you might wonder, well, what's the motivation of them setting up ombudsman's offices? Now, I'll tell you what the motivation is. The motivation is that creating an organizational ombudsman is helpful in mitigating in cases of civil lawsuits. So if an employee is alleging, for example, sexual harassment against a supervisor, the case law in the US has recognized that if that organization has had an ombudsman where people can turn to complain, it mitigates losses in civil cases. So that's one reason why there's been this proliferation of ombudsmen in the private sector. Why do governments adopt this model, the organizational ombudsman, as opposed to a classical ombudsman? It's because you have much less to fear from an organizational ombudsman because they don't have the same level of independence. The risk, however, is that they don't have the same level of credibility. Now, the way the Ombudsman works is that I have very robust investigative tools, power of entry, in any provincial building or facility, including jails. In other words, I can just show up and go anywhere where the provincial government is located, and they can't deny me entry. I can subpoena witnesses to testify under oath, to bring documents to the office. I'm not compellable to testify in any court proceeding. And I can't be sued. I'm immune from civil liability. These are very powerful protections and investigative tools that allow me to do my job. That's all in the legislation, the Ombudsman Act. And anyone who obstructs the lawful direction of the Ombudsman is guilty of an offense punishable by jail. Which means that, guess what? I get a lot of good cooperation from the provincial government. However, at the end of the day, I don't issue rulings like judges. I issue recommendations. So it's all about moral suasion. It's about my ability to convince the authorities that they need to change something. And that we've been overwhelmingly successful at getting. Will we see an Ombudsman of Canada one day? I'm not sure the answer to that is. I mean, have we gone federally to a point of no return? In other words, all these offices, all these different interests. You know, we created all these tentacles that we can't claw back, because we'd have to shut down all those offices, go back to 1978, and set it up properly. That I do not know. In Ontario, there are some limits to what we do that are unfortunate. And these are gaps in our legislation that were identified by Ontario's first Ombudsman, Arthur Maloney, and they're in respect of the lush sector. The municipalities, universities, schools, hospitals, children aid societies, long-term care, homes. These are all outside the reach of the Ombudsman. They're all funded by they're all funded by provincial public funds, but I can't oversee them. In other words, I can oversee a decision by a public servant at the Ministry of Health and the Ministry of the Attorney General, but I can't follow that decision, how it's executed. So the provincial government says it's going to be zero tolerance in schools. That's the direction to schools. I can't entertain complaints about how this policy is being implemented on the street level. And if you look at the other provinces, this is where our mandate lags. And it lags behind, and it's unfortunate. Look at public hospitals. Every single province in Canada has the provincial ombudsman overseeing hospitals. Every single one of them. So when people say, well, can we afford it? Well, I say, well, if they're not allowed, we're going to afford it. Yukon can afford it. Child Protection Service. Who do you complain to? The Children's Aid Society abuses their power. Who do you complain to? Well, they would say, well, they can complain to us. Right. They can complain to the board of directors. Right. They can sue us. Right. There's no independent investigative body that can come in and investigate issues that involve some of the most vulnerable people in our society. Same thing with hospitals. What if you think a doctor is not equipped to conduct a certain operation? We've all seen cases that have glaring problems with them. C'est difficile. That's in one hospital, it's in another hospital. Who deals with that? Who sees whether the provincial norms have been applied? If the hospital has been neglectful, are you gonna, every time someone's sick, do they have to sue them? If you're in another province, you can turn to the ombudsman of that province. In Ontario, you can't. So these are unfortunate situations, especially the hospital sector, the healthcare sectors, responsible for $40 billion of spending in provincial tax money. So every year, when I release the annual report, I make the call to the provincial government, just as every ombudsman has since 1975, that we need to close these gaps. And so far, we have not seen an appetite for dealing with these gaps in our country. Well, I mentioned to you earlier that we see our role as well as promoting good governance, open, transparent government. And if you look at our website, our use of social media, we are the leaders in our field in leading by example. And tomorrow we'll be unveiling our own mobile app for office. You'll be able to launch a complaint using your iPhone to read this speech online as of tomorrow, to look at complaints trends. And so we'll be right there in your pocket, on your phone, and we're very happy. We look forward to unveiling that tomorrow. Make sure you follow us on Twitter, check out our Facebook, and our YouTube. I'll be happy to take your questions.